can't believe that happened. So hi, Dr. Nikita Vizniak here with the amazing
Anita.
And Anita came in with an interesting TMJ case. So what I'd like to do is have Anita kind of share her story with us, and we'll ask her some questions as she goes through. I think it's a great learning opportunity for any students or other practitioners out there. So Anita, tell us how you first came in to see me.
So I got into a car accident where I had a concussion, and afterwards my jaw was clicking. And that happened for a couple of months, and the clicking started to get more intense and more like popping, and then it just kind of fully popped and it wouldn't open anymore.
Yeah, so it seized right up on you, and so you came initially because you wanted to have your back looked at, and then you're like, well, can I show you this thing too?
Yeah.
And then we had a look at it. So we had a look at it. What were the treatments that you got from me on the first visit?
I don't know any technical terms.
It's okay, you don't have to say it, just say the regular, what the words are.
Well, first you measured the opening to see where we were at.
So yeah, we did a basic range of motion to check to begin with, which is part of our basic assessment.
Okay. And you touched in the neck and near the ears, and you tried to see where the pain was coming from.
Yep.
And then you did some manual adjustments.
Yeah, some movements of the neck and everything, some mobilizations there. Now, the interesting thing for me on this case was you were also seeing a dentist at the same time.
Right.
So what happened there with that visit? The first visit especially.
Yeah, my dentist thought he might be able to open my jaw back up. So he put his thumbs in my jaw and bared down on it. And he put so much weight on it, his hands were shaking, and that really scared me. So that's something I shared with you on the second appointment.
Yeah, totally. And what else?
Oh, and he used a laser to loosen up my muscles to see if that would help that as well. And then he gave me some gauze and got me to try to close my bite as much as I could. My jaw was shifted slightly, so that helped shift it back into line a bit. Yeah.
And I remember when you first came in, there was a lot of fear around it too. Like you had a lot of pain, a lot of concern. You couldn't even eat food correctly or anything like this, right? Now, the other thing that happened with one of your visits, though, was also that you were recommended surgery potentially fairly early on, and injections to drain out the joint. Like, tell people about that and what your experience was hearing that.
Yeah, so obviously it's scary to not be able to open your mouth, and you're just kind of drinking your food, and there was a lot of pain. I couldn't sleep very well, and so when I called my dentist initially, he said go see an oral surgeon, and there's a procedure they can do where they put fluid in to flush out the inflammation, and then they put steroids into your face, and then they're able to see it, and they're able to do a second surgery where they cut open and repair your tissues, and you'd have a nice, I was worried I'd have a Joker scar.
Yeah, I remember that's what you said. I remember you said that, yeah. So you said exactly the Joker where it's all big, the big smiley face and everything like this. So, but as a patient, what I'm trying to get at though is what was your experience with that? Like, how did you feel when you heard those things?
I was so frightened, and one of the main reasons I came to see you is because I just needed someone to tell me you're not having surgery today, because the way it sounded was they're going to cut your face open and it's going to happen today.
Yeah. And
some of the risks they were saying were you wouldn't be able to raise your eyebrow, you wouldn't be able to close your eye. So I don't even know how that works. I was just thinking, oh my God, I'm going to have dry eyes forever because my jaw won't open. So.
Yeah, and so basically my treatment just mainly evolved around education for you. Just these are the processes, and my biggest thing was delay these things from happening because I think we can reach better results with a more conservative management style, right?
Definitely, yeah. And it really calm my nervous system down, which was also not helpful to be stressed because I was tensing my jaw even more.
Yeah. So exactly, it was like a double effect on it right there. All right, so I just wanted to share that with everyone. It's a quick little 5-minute video here. Is there anything else you want to add?
No, I just really appreciate you, and I'm glad we met because now I can open it a lot more and I don't need surgery.
And you're back to eating almost regular food again and everything like this, right? So these are the big wins right here. And these are outcomes that really matter for patients. So that's why I want to focus on this for this visit. So thank you very much for sharing.
Thank you.
All right.